and we are back with Tuesday Tips with Dr. Vidal here at Pure Plastic Surgery. This is our weekly check-in. We discuss different topics in plastic surgery, and I get time to answer your questions. Today, I'm gonna discuss a different topic. It's a topic not per se of one or other procedure. It's actually a topic that covers every procedure. It's about surgical markings. Surgical markings is one of the most important parts of the surgery, and it's unique for plastic surgery because plastic surgery has the artistic component to surgery and has the planning of it, okay? So once we go into, we always say, once we go into the OR, I'm not planning that much. The plan is already made. I made our surgical plan the day before on our pre-op when I discuss everything with you, and the surgical markings. The surgical markings, why are they so important? Because when you're standing up, the things are completely different than when you're laying down in the operating table. So I have to plan the surgery with everything in mind, so when you're laying down, I can take that into consideration and you have the best result. So once you're in the table, I'm not planning. The plan is already made, and that is with the surgical markings. And the surgical markings sometimes is a stressful time for some patients because you are naked in front of me just before the surgery without any clothing and just standing there. So I just wanted to go over what is it that I'm doing. And a lot of patients are like, you're drawing all over my body. What is it that you're doing? You're putting a lot of markings all over. What is that? Are all those incisions? Are you cutting in all those places? The answer to that is no. Most of the time, most of the markings are not actual incisions, are landmarks, areas that I need to mark because when you're laying down, things change, okay? So I'll start with the markings for a mommy makeover. The markings for a mommy makeover are here. Those are a little bit more involved, they're more complex. Why? Because it involves the lift and the tummy tuck, okay? So the breast lift, the important thing about the breast lift is, one, we change the position of the areola, right? And we reshape the breast. So instead of having a long elongated breast, we make it a round perk-here, okay? So what is the most important part of the breast lift markings is actually the position of the new areola. How do I choose this, right? It's not a random marking. It's not that I just look at you and go like, I think it looked good here. No, it has a lot of markings involved. So first thing I mark is the middle, the midline, okay? Why? To have the most symmetry as possible. Breasts are not always symmetric. In fact, they're never completely symmetric. We're all asymmetric, but I try to make them as close as possible, right? Sisters, not twins, but pretty look-alike sisters, okay? So that's the first mark. Then this line that you see down here, that represents the fold under our breast. That's called the IMF, inframammary fold. Why this fold is so important? Because it correlates with the new nipple position. If we review what is breastosis or droopiness, it's a relationship between the position of the areola and that fold. So when the areola is at the level or below, then we have breast droopiness or ptosis. So correcting that, we need to put the areola and the nipple above the IMF, okay? So that's one of the most important markings, the IMF, and I just the IMF goes like this, right? But the inferior part of it, I just make a line towards the middle so I can see it in the center, okay? 4 centimeters superior to that is this little line that you see here. This little line extrapolated to the breast is gonna give us the new position of the areola. So there are a couple of things that I measure. This is 1, the position of the fold is 2, the distance from the sternal notch, which is this little bone that we have here in the center, to our new position of the areola, which should be around 20 to 24 centimeters. And I look at your arm as well. The position of the areola should be usually mid-humerus, mid-arm, okay? So all of these things taken into consideration, this, and here in the center. Also, this line here is called the meridian of the breast. So I just told you all of this gives us the height of the nipple. This meridian gives us the center of the breast. So the meridian goes from the neck towards your nipple. So that line here is the meridian or the center of the breast. And that's where the new areola and nipple position should be. So after I measure this from here to here, here, and the fold and the meridian, that's where I choose, that's where the nipple and areola complex should be, okay? So I put a little dot there, okay? After I do that little dot, then I have to make our triangle here. The triangle represents the area that I'm gonna resect, okay? And you say, but inside of the triangle is the areola. Are you gonna resect the areola? No. So the areola, we keep it attached here, but the tissue that is below that little triangle and areola is removed, okay? So it depends on the type of breast lift or reduction you're doing, but most of the time I keep the tissue that is superior here and remove the one in the bottom, okay? That allows me to keep the breast tissue at top, which is usually what we want, more cleavage and more fullness at top rather than at the bottom, okay? So keeping this triangle about 7 centimeters wide and 7 centimeter long in the vertical incision. So this line and this line will meet in the center to form the incision that you see that goes from the areola down to the IMF in the anchor type of lift, okay? So, and the one at the bottom, you don't see it on this picture because it's in the fold, but it goes more or less from here to here, okay? And that is all our markings. So what are incisions here? Incisions are gonna be here, and this is gonna be the incision around the areola. Here and here, which are the incisions that are gonna come together and form the T part, okay? The vertical aspect of this incision, and the one in the fold that you don't see in this marking, but that's gonna complete the anchor type of lift, okay? So all of this markings, all of this is just reference points that are important for me to choose the areola position, the width of this triangle, the length of the triangle to mark appropriately for your body shape, for your breast size, okay? So where does the implant go? So I usually put the implant first, okay? So all of these markings it's my plan, right? This is already done before you go to the operating room, because once you're flat on the table, the breasts are not gonna be like this. They're gonna be on the sides, right? Displaced laterally. So all of these markings help me orient myself. I first do an incision in the lower part of the areola, put the implant first, and when I'm doing the lift, I like to put the implant under the muscle. There are a couple of reasons for that, but the main reason is if we have any wound healing problems with the breast lift, the muscle kind of offers an extra layer of protection in case we have any wound healing problems and the implant is not exposed, okay? So I like to put the implant under the muscle. So I put it in and then close the area where the implant is and then work on the breast lift. That allows me to tighten everything very well so it correlates with the implant, okay? So all of these markings usually are the final, but I also put you sitting up in the operating table and make sure everything is symmetric, everything is tightened up, and I don't have to revise anything, okay? So it's almost a complete guide, but there's always touch-ups in the operating room once I put the implant and once I check everything is in place, okay? What about the tummy tuck? So this line, I continue down here, that's the center, okay, midline, okay? And it continues down to mark the midline down here, and that's, I'm asking this patient to lift the abdomen here, and you can see it down here, okay? How low I can make this incision is a very common question. I make it as low as possible. What is as low as possible? So I measure the distance from the cleft of the vulva upwards, and that's 7 centimeters. Why not lower than that? If I make it lower than that, then I'm lifting your vulva. So this area and that pelvic area gets stretched up, and that doesn't look nice because you're gonna have like a stretched pelvic area and genitalia. And the other thing that can happen is because everything is stretched up, your urine stream can actually go forward instead of going down. So sometimes that's can be a complication if someone makes that incision very low and that is pulled up. People complain that's like when I'm sitting down in the toilet and I'm trying to pee, it goes to the front instead of going down. It's because of that pull. So that's why it's so important to keep those 7 centimeters, okay? I know we want to hide the incision, but there are reasons to make it to the level that we need to make it, okay? What are these lines on the side? I measure that to 7 centimeters and 7 centimeters. Why? So when I'm closing, I'm putting together everything at the same distances, okay? I'm not putting it like shifted and the belly button is on the side. Remember, when you're laying down, things can go side to side. I want to make sure that I'm putting the center to the center and this two to each side, okay? What about the corners? The corners is very common. Usually we have more skin on the top side than in the bottom because we have excess skin on the top side, and that's what we're trying to remove. That area, I try to bring it to the center, okay? And that is why sometimes in the early post-op period, you see that on the sides of the incision, you see like little folds of skin. And people are like, why do I have these folds of skin? I don't like this. It's on purpose to try to avoid the dog ear deformity. What's a dog ear? Dog ear is when we have excess skin on the corner of the incision. Why does the dog ear happen? Couple of reasons, but usually when the excess skin reaches all the way to the back that we can't reach because you're laying on the back on the operative table, sometimes you end up with a little dog ear there. Sometimes swelling, because remember, I do also liposuction to that area, okay? So there is some skin contraction that's gonna happen when the swelling comes down. And once that swelling comes down and the skin doesn't retract all the way, sometimes we have a little dog ear there. If you end up with a dog ear after a tummy tuck, it's not the end of the world. It's actually a revision that's very easy to do. We do it usually in the clinic side or in the operating room, but not under general, just under local anesthesia, just putting a little numbing like dentist anesthesia, little numbing medication at the skin, cut that excess skin and sew it together, okay? So if you do have a dog ear, just send us a message through Clara and we can take a look and fix it. But basically it's a result of that excess skin reaching too far back behind that I can't reach. Sometimes what patients think of a dog ear is actually excess fat. So if the dog ear is more like you're pinching it and you feel thickness, that's actually more fat in that area. So the solution to that is not a dog ear revision, but actually liposuction, okay? So sometimes when you, remember I have a limit of 1 liter of fat removal when I'm doing a tummy tuck. So there's a limit of fat that I can remove. If the fat goes all the way to the back, I can't reach it in the tummy tuck. So sometimes when that swelling comes down, you still feel more thickness towards the back side there on the sides. And that, I can take care of that with a Lipo 360 to kind of thin everything down, okay? The drains on the tummy tuck go on the side, so I put a little mark on the corners of those incisions to mark the area where the drains are gonna come out. And that is, oh, and one more mark is the liposuction, and I'll show you with the BBL markings, those circles. So I'm gonna make those circles. What are those circles? I remember one of my best friends that I did surgery on her, and I'm drawing her markings, and she's telling me that I look like a 5-year-old drawing circles on her. No, it's not a 5-year-old marking. Trust me, the circles have a reason, okay? So the reason for it is marking the areas of thickness. What is more thick? So the center represents the area that is thicker, and the edges of the circle represent the areas that are thinner, okay? So I have to prioritize or thin down more the centers of it. So that's why when I'm marking the areas of liposuction, I'm gonna be pinching you, okay? When you see someone marking the areas without touching the patient, you can't really tell. So I'm gonna be pinching you, palpating your skin, palpating your thickness to see where is those areas, where's the thicker area, where's the thinner area, to center where I need to prioritize. Why is so important to mark the liposuction? You can tell, you may think, you're gonna you're gonna thin everything down. Why do you need to mark it? Remember, I inject tumescent fluid before starting the liposuction. What is tumescent fluid? Tumescent fluid is saline mixed with a medication called epinephrine. Epinephrine, what it does is it prevents or lowers the blood loss. So it causes vasoconstriction. The blood vessels constrict so they don't bleed, okay? So I need to put, that is an essential part of the liposuction, but when I inject that, everything changes because I'm blowing everything with fluid up, okay? So I need to have my markings well, because once I inject the tumescence, everything is thick. Now I don't know where was thick, where was not. Everything gets blown in with fluid, and I need to have my markings, and that tells me this area is blown, but it's more fluid from the tumescent. This area is thicker, but it's where the fat was, and that's where I need to prioritize, okay? What are the other markings? This patient had a BBL, so what are the markings that I do in your buttock, okay? So if you can see down here, this little 2 circles, some people have those more defined, some people not that much, but you may have seen it in people that have those little dimples in the back. Those represent the sacral ligaments and the sacral attachments. That there, connected to the gluteal cleft, marks the upper part of your buttock, okay? So that's where the limit of the back and buttock, that interface between back and buttock, okay? So that's where I mark your upper buttock. And why is it so important? Because I'm gonna thin this down and start adding volume. And that's gonna create that smooth curve, okay? If I do it too high, it's gonna look weird. If I do it too low, it's gonna look weird. So that's why this mark is extremely important, okay? I mark the gluteal cleft down here. I put it in the picture, but you can see it a little bit here. I mark the lower part of the buttock, okay? And this cross, that represents the point of maximum projection of the buttock, okay? So I do it a little bit tilted so I see where is the maximal projection of the buttock, and that way I can add more volume, usually in the center, and usually most of the patients are asking for the upside down heart shape, which means a little bit more volume in the bottom part of, so I prioritize more on the bottom and thin it down in the upper part to create that hourglass upside down heart shape, okay? The other thing that I mark, and you can see it a little bit here, is the hip dips, okay? So after marking the back, I'm gonna ask you to turn, and when you turn, I mark the hip area. The hip area is as important as this upper mark of the buttock. Why? Same concept. I'm gonna thin everything above my mark and start injecting below my mark to create that smooth curve hourglass figure. If that mark is not in the right place, the hip is gonna look too high or too low. And once you're on the operating table on your belly, things change. So that's why standing up is gonna be super important to mark those areas and mark the areas of the hip dips that I need to fill in to create that smooth curve and more projection on the hips, okay? That is with BBL. This is a breast augmentation one, okay? Breast augmentation is similar to a breast lift, but on a breast augmentation, I don't change the position of the areola, okay? The areola stays in its place. So what do I mark? I mark the center, I mark the IMF or the inframammary fold, and what is this? This is the upper pole of the breast. And the center here is the medial extent of the breast. Why is that so important in a breast augmentation? Because if I dissect more in the center or more superior, we end up with an implant that is too high, or we end up with an implant that is too medial, and we cause a uniboob, or just connect the two sides instead of having a cleavage in the center. This area here is extremely important to keep, because if not, we're gonna create a deformity that is actually very hard to fix. A deformity where the implant is too medial and we don't have a cleavage is very hard to fix. So these markings in the breast augmentations are the most important part. And up here, to put you want the implant under the breast, right? We want to add volume to the breast tissue. So that markings tells us exactly when I'm doing the surgery, where I need to make your pocket to put the implant, okay? And Basically, this line here and here, that's the meridian of the breast down. So I make the incision just lateral to that. So you don't have, if you want to wear like a very tiny bikini, the incision doesn't show in the center. It's more to the side where more of the breast tissue folds, and you can hide it very well. Okay? And arm lift. This is the other very common procedure that I do. Arm lifts. Arm lifts, the most important part of the arm lift is this line. This line is going to represent where the final scar ends. And the trick with a good brachioplasty is to try to hide that scar as much as possible. How do we hide it? In a position that when you're laying like this, the incision is on the inside, but you can't see it from the back side as well. So that's the trick, that it's on the inside, and when you lift it, it's on the inferior aspect. So when you lift your arm, you gotta go like this to see it, or like this, and then people see it. So that's the trick, okay? What do I take into consideration? I measure your elbow, measure the axilla, and the muscles here, which are the biceps. I'll palpate that and make the line just there. Try to get the scar to hide, and when you're with your arm down, can't really see the scar, okay? This type of breast lift is brachioplasty or arm lift. It's an extended brachioplasty, and it extends and it connects with the incision of the breast lift, okay? So this is not super common, but it's common in my massive weight loss patients that tend to have a lot of skin excess on the side of the chest as well. So that incision can connect from the axilla down on the lateral chest, excise that excess skin, and connect to the inframammary fold incision on the breast lift. Okay, and this marks, like I explained here on the tummy, these lines are very important because it guide me to close it even and not close it tilted, not pull on one side more than the other. I'm closing line to line to keep it even and make that line centered in the lower part of the arm, trying not to show as much as possible. Okay, what are the things that are important when I'm drawing all of this? You don't need to know all the markings. You don't need to know how many centimeters I need to mark in one area or the other. I just explain this to you so you understand what I'm measuring, what I'm seeing, and what can you do? Try to relax, okay? When I'm marking you, I need you to be as relaxed as possible. What happens when you're tense? Kind of go like this, you kind of go and tore your body and move your arms and move your shoulders. All of that is gonna uneven my marks. So you try to relax, put your arms on the side. Sometimes people go like this. When you go like this, that shifts the breast up, right? So I want you with your arms on the side, trying to relax and trying to put the center of your weight in both of your legs. Instead of like putting one side or the other, that's gonna shift everything up, okay? So those are the tricks for you. So you're more calmed in the center and trying to relax. And now you know what I'm doing, right? Measuring back and forth to try to give you as symmetric as possible. I know perfect is not possible, but as symmetric as I can, okay? Any questions, you guys?
A lot.
A lot? Let's do it.
Okay, first of all, I'm sorry. Can you give me something for nausea after surgery?
Yes, that's actually one of the prescriptions that I give to all of my patients. So nausea can happen after general anesthesia, unfortunately. Not to everyone, but to a good amount. And since you're going home or, this is an outpatient surgery, so you're not staying here, I give it to all my patients just in case you need it, you have it available. The prescription we're gonna give you, it's called Zofran. So it's a good medication for nausea. You can take it with a little bit of water, or actually if you're very nauseous, you can even put it under your tongue and it dissolves.
Okay, second question. Can BBL be combined with chin, body tight, and hump lipo?
And hump lipo? Yes. Yep, all of that can be combined. Remember, I have a limit of 4 liters of fat to remove, okay? So depending on your BMI and the extent of the fat in those areas, We can decide if it's good to combine it all in one surgery or stage it. It all depends. But those areas usually are combined, and it can be done with the BBL.
Talk a little bit about the BMI limit.
Yes, so BMI, it's the body mass index. It's a number that we use as a reference. It's calculated using your height and your weight. So if you want to know what your BMI is, it's very easy. Just go to Google and put BMI calculator. It'll pop up a website, you click it, and you put your height and weight, and it tells you a number. What does this number mean? So it's just a reference that in medicine we use to determine if you are in your range body weight, if you are overweight, or if you're obese. And in surgery, it correlates with complications. So the higher the BMI, the higher complication rate. So that's the reason why to put a limit on a BMI when we're doing surgical procedures under general anesthesia. It increases the risk of blood clots, it increases your risk of infections and wound healing complications. So what is my limit? My limit is 33.5. What does that mean? More than 30, it's obese class 1. Okay, so when you are 20 to 25 is normal BMI, 25 to 30 is overweight, more than 30 we start with the obese classification. More than 35, we're looking into morbid obese patients, okay? So more than 35, the risk is too high, and I don't do surgery on more than 35. I limit it to 33.5. Why? Because you're closer to the 30. 30 to 35, we do have a little bit of increased risk complications because of the obese category, but not as high as 35. And also your results might be compromised. Why? Because I have a limit of 4 liters of fat to be removed. So when you are higher than 30 in your BMI, I'm probably not going to be able to remove all the fat, right? So it's going to be a compromise. Your shape is going to be better. Your result is going to be great, but you probably will have fat left. Some people decide to come in a second round of liposuction, or some people just lose weight afterwards and get to the ideal body weight, just diet and exercise after the surgery, which is also a possibility. But that's why my limit of 33.5. The goal is, if you can, to have a BMI of less than 30 before the surgery. That's going to optimize your results and definitely decrease your complications.
Okay, should I do the Lipo 360 alone, or should I do it with the arm lipo?
So arm lipo, it's a very common and good thing to combine with Lipo 360. Why? Usually arm lipo, even though we all think our arms are huge, they're not really that, they don't have that amount of fat that we think they have. So they're not gonna affect dramatically the amount of fat I'm not gonna remove from your torso because I'm doing the arm lipo. So even though you think it is, it's not that significant. So I do usually advise to combine arm lipo with Lipo 360. It's a good combination. The other good thing about combining it is our bodies are all about proportions. So if you thin the waist, if you thin your torso, then people are like, now all the fat is going to my arms. It's like, it's the same amount of fat that was going before. It's just that your torso is so thin that you're gonna notice your arms bigger. So if you do have some concerns that your arms are a little big before the Lipo 360, I do advise to combine it because you'll notice that difference afterwards.
Someone with diabetes type 2 but's control, do you still do the surgery?
Yes, but your hemoglobin A1C, which is the lab that we do to check your diabetes and your sugar control for the last 3 months, needs to be less than 6.5. Okay, so yes, but needs to be controlled.
Okay, the most common question for us: can you do a mommy makeover with a BBL? 5% ask the same.
Okay, so the short answer is no. The reason for it is 2 main reasons. One is safety reasons, okay? We go back to the Florida Department of Health limit of fat that I can remove. With a mommy makeover, I can only remove 1 liter of fat, and that is to keep you healthy and safe. Why? Because you're going home, you're not staying here, okay? So when we're combining that much surgery, you should be monitored in the hospital or in a facility that monitors you overnight. And that is not the case here, okay? So that is the reason why we limit, and the Department of Health limits the combined mommy makeover with only 1 liter of fat removal. And that is not enough for a BBL. For a BBL, we usually go up to 4 liters. Why? Because that's gonna give you a more different and more noticeable result in the contour, okay? The other reason is recovery, okay? So the recovery for both of these procedures is actually opposite. And I don't really know how you can combine them and still have the best results with both of them. When you're doing a mommy makeover, you're doing a tummy tuck. So I'm gonna tighten your muscles, tighten your skin. So I'm gonna ask you to be walking bent over and sleeping in your back with the legs flexed, so you're not putting tension on this. When I'm doing a BBL, I'm asking you to do the opposite. I'm gonna ask you to sleep in your belly to avoid putting pressure to the fat grafted areas. So if you're planning on sleeping standing up for 6 weeks, maybe you can do the tummy tuck and BBL at the same time, but no. Okay guys, thank you so much for joining. Thank you so much for your questions. I hope this surgical markings discussion helped you guys ease the stress and ease the anxiety when I'm doing this. I'm measuring, but I'm measuring to try to make it as perfect as possible. I'll see you guys next week. Please send me topics of things that you want me to discuss, and I'll get to it, and I'll see you guys next Tuesday Tips with Dr. Vidal. See you guys.